Hello everyone, my name is Farley Duvernard and I'm doing a presentation on a biotech company called Vigilant Bioscience. Vigilant Bioscience is a company that pretty much aiding clinicians in improving potential outcomes through earlier detectations of the oral cancer. You guys are probably wondering what is the oral cancer. So I'm going to explain that to you now. The oral cancer is pretty much they call it the mouth cancer, and it forms in the oral cavity. This includes everything that's in the mouth that you can see in the mirror, right? So we're talking about your lips, your gums, your tongue, your cheeks, the roof of your mouth, the floor of your mouth, the back of your throat. Anything that you see when you open your mouth, that's what the oral cavity is. And because of that, oral cancer develops in your mouth if left unchecked. Now, who are at risk for having oral cancer? Um, People who smokes are a very high risk at smoke having this type of cancer because when people who are a smoker, in retrospect for the dental world, when you smoke, you recede gum. If you gum starts to recede, you start to lose bone, and because of those two main factors, your teeth are going to start becoming loose. And because of that, bacteria that normally don't go around these areas start settling in and manifesting, and then you'll start seeing redness and bumps, and this is where things are starting to become a problem. And because of Vigilant Bioscience, they found ways to detect these type of cancer early. So if it starts to develop, we have ways to, you know, prevent it becoming a problem later on. So vigilance, like I said, they found ways to detect this type of cancer early. And one of the techniques that they developed is called the Vision Rapid Test. The This is kind of like when you have a self COVID test. What they do is you have a a container filled with saline, and what they do is they have you take that saline, swish it around your mouth, and spit it out in this little cup, and then they'll have the solution that they have, and they'll dip it into the cup, and then the doctor will have to wait 10 minutes in order for them to detect if you have cancer or not. During that time, they're probably going to do their, clinical assessments, probably, your cleaning and whatever the evaluation that they do, and then during once that 10 minutes up, they'll go ahead and they'll see whatever the results are. Now, because of this techniques, it really helps the doctors know what type of situation that you have in your mouth. Also, if you have any type of symptoms or anything that you see in your mouth, this test helps really works to make sure that you have cancer or not. So because of this, it is really a very simple and non-invasive way to approach this matter, and is really safe for the patients. Patients are not a threat. Patients obviously are very anxious when it comes to the doctor's office, and having all these instruments all over the place kind of makes them scared. So having this little simple way of finding something like this is really very beneficial. Um, Recommendations I will tell patients, well, sorry, because I'm a dental assistant myself. One of the recommendation I'll tell is pretty much really don't smoke, right? Um, as I said before, it really causes a lot of problems later on. Drinking way too much. When you do drink, at least wash, with maybe mouthwash or at least water. At least get some of that sugary taste out your mouth before it leads to any more problems, right? Um, Brush your teeth at least twice a day. Brushing your teeth is really beneficial. It really takes away all the bad bacteria that accumulates over time, like plaque, and then really, get you away from the dentist too. Even though you try not to go to the dentist, regular checkups to the dentist is a must too, because they are the ones know how to find these type of cancer early, and if left unchecked, it's going to be issues. I am a surgical dental assistant, so I do see these cases all the time. A lot of periodontal disease, sorry, gingivitis. Patient comes in with one or two teeth, and the doctors are trying to find ways to help them solve this type of problems. So um, when I looked up this type of when I looked up this company, it was actually I was actually really interested to see the work that they're doing and ways to help our patients, improve on their health and better in their life. So thank you for watching, and hopefully you learned just a little bit of something of this company and pretty much what I had to offer you guys. So thank you.